For decades, if you wanted to check your heart health, your doctor essentially took your blood, put it on a scale, and weighed your cholesterol. But millions of people see a healthy cholesterol weight on their chart and still suffer unexpected heart attacks. Think of that standard cholesterol test like a highway weigh station. It only tells you the total tonnage of all the vehicles passing through. This scale shows exactly how that works. One giant slow-moving bus weighs the same as 50 tiny reckless motorcycles swerving between lanes. They weigh the same, but the chance of a crash is very different. Inside your blood, those large buses represent safe cholesterol. The tiny motorcycles are the dangerous particles, small enough to crash into your blood vessel walls and get stuck. To prevent a heart attack, medicine had to stop weighing the overall traffic and find a way to count the individual dangerous motorcycles. Let's look inside the body's internal roadway. A new field called precision cardiology uses an advanced blood test for a particle called ApoB. Think of ApoB as a tracking device placed on every dangerous motorcycle in your bloodstream. These two samples have the exact same cholesterol weight, but by counting the ApoB trackers, your doctor can see if your blood is actually the sample packed densely with small particles, revealing a hidden risk. There is also a test for a genetic wildcard called Lipoprotein A. This inherited bad traffic remains in your system regardless of a perfect diet or intense exercise. Because it is invisible to standard tests, current medical guidelines suggest every adult have their lipoprotein A checked at least once to understand this baseline risk. Counting the traffic is only part of the story. We also need to inspect the road itself for vascular inflammation. Even if your blood traffic is light, a damaged blood vessel wall makes a pileup much more likely. Checking inflammation markers provides a critical second layer of defense. Counting traffic isn't enough if the highway itself is on fire. Doctors used to rely on older imaging hardware, like the standard calcium score test. It could only detect old, hardened blockages, which meant it often missed the most active threats. Most sudden heart attacks are actually caused by soft, hidden plaques. These act like invisible sinkholes lurking beneath the road surface, ready to cave in without warning. Modern scans called CCTA act like X-ray vision. They use artificial intelligence to look through vessel walls and find hidden sinkholes. The AI identifies the volume and shape of these plaques, providing a data-driven map that quantifies risk and supports your doctor's clinical judgment. Spotting these sinkholes allows for targeted treatments that stabilize the road years before a heart attack can occur. We are moving away from guessing risk based on general population averages. Today, we rely on your specific biological data. This is the Precision Cardiology Playbook, combining advanced blood tests to count the traffic with AI cameras to map the road damage. Viewing heart disease as a measurable process changes the experience for patients. They can see exactly how their treatments are working to stabilize the road, turning an invisible worry into a series of manageable data points. Prevention now rests on understanding the unique makeup of the individual. This is how we map the path to a healthy